Hello, my name is Mandy Garza. It's a National American University, and today's topic would be on healthcare administration. We'll be discussing the disease management, delivery of care, healthcare coverage, Europe, Australia, compare and contrast of Europe and Australia with the United States. We'll be showing you graphs, the rankings, best practices, and of course our references. Disease management is one of the healthcare topics within the US. It was created in 1990. It supports people with chronic illnesses. It's based on the socioeconomic of people. It's a private marketplace, meaning there's been situations where um, the government has planned different programs to reduce the cost, and of course, development. Disease management is, like I mentioned, it's based on the chronic illnesses, meaning something that a person has very serious and they need some sort of medical attention or medical support outside of a facility, whether it be at work or home, especially more at home. So that's where the home health cares come in or the home providers. I say it's a socioeconomic people because it's usually maybe the middle class or the lower middle class or the lower class in general. The private marketplace, which be a reduced cost, would be how the healthcare tries to reduce the cost of what it takes to hire or have people within this program to pay them or find ways to pay for the expenses. Developments. There's always new developments trying to be um, developed in order to help out people, people who are insured, people who are not insured, and especially the people who are going through a chronic illness. So there's always developments coming up. And right now, with the government not being so, I wouldn't say so concerned about the healthcare, but not being so reliable on them, it's another thing because how can the government develop anything new for us if they don't even know what they're doing to begin with? Because I mean, Obamacare is not in place anymore. Yet Trump's administration is trying to figure out what other kind of healthcare coverages there is possible that could replace the Obamacare. So I mean, it just depends what kind of government we have supporting us. Next, we have the delivery care. It's a unique system. It's a payment options. It's a healthcare delivery or healthcare services. So subsystems developed and employers insurance. It goes from employers to insurance to payment to delivery. This one, let me start off from the bottom to the top. If you are employed full time, may I add, if you're employed full time, then you get the benefits of having an employer who is providing you with some sort of healthcare coverage, which involves from employers to insurance. Once you pay your premium for the insurance, or like in my case, I work for the district, so we have the option of paying um, a premium for us and our family, or we have the option of just having ourselves on the insurance covered. So, meaning the district has to pay for our insurance, and I have that option, to be honest. So, from there, we have the employer's insurance, and then you have the payment method, which could be like your copay. And once you visit a doctor or a facility, the emergency room, depending on what your copay is, then you pay it, and you get, of course, the delivery of the service you're requiring. Um, I put that delivery care is either healthcare delivery or healthcare services because it could be from healthcare delivery to the services you may need. It may be from actual treatment to just services that you may need outside the facility, like mentioned in the previous slide. Of course, payment options because once you get the delivery, if you don't have the means to pay up front, you have payment options. You could pay it in payments, you can pay all at once, credit card, have installment plans, anything like that. But as long as you pay for what you received. It's a unique system only because it gives you the chance to have some sort of a delivery of a service, product, treatment that you are required to have or to need for some people. So the way it works is just, it makes it very unique. Healthcare coverage. Healthcare coverage is a very, how do I say, touchy topic nowadays, especially like I have mentioned in the previous slide. With Trump's administration, we really don't know what kind of healthcare coverage we're getting here in the U.S., especially with there not being Obamacare, but yet the new healthcare plan that Trump wants to input. It seems like it's helping out more the the wealthy people, you may say, than what it is for the middle class and the lower class. But yet again, the type of coverages that we do have at the moment, of course, you have the private insurances, which you go on your own and you get whatever kind of insurance you need for yourself or for your family. But yeah, you have the public services like Medicare or Medicaid, A and B. So like that. But those, once again, the public ones are limited because you have to have a certain amount of income coming in. You can't have this, you can't have that. Some of them require you to have certain illness, anything like that. So, but at least you have the option of having a private and a public one, at least here in the United States. Yet, even though we have healthcare coverage, there is a lot of lack of insurances, because since insurances nowadays, the rates are ridiculous and they just keep going up every year. It makes it very hard for a majority of the people to have insurance. It's not that they don't have access to it, they just can't afford it. Like I mentioned, affordable health programs have been dismissed, like the Obamacare has been dismissed, and new ones are trying to come into place to take over that one. And I mean, it's a pro and a con, because majority of people benefit out of the Obamacare, but yet some people say they didn't. So it just depends, I guess, on your opinion. New health programs coming under Trump administration, like I mentioned. Of course, any kind of at least public health care coverage is covered by the Congressional Budget Office. And of course, any type of kind of healthcare, it goes off of your demographics. So like I mentioned, you have the wealth, the middle class, the low class. So depending where you are and depending your income, it depends if you can actually afford or not, or if you qualify for the public services like Medicaid or Medicare. In Europe, the healthcare system is very different. It's on a national level. It's a public insurance. Of course, they tax you. They allow you an insurance card, and it's valid all over Europe. But of course, you have the private insurance available. The good thing about Europe, unlike US, it gives you the option. If you're in the country, you have health coverage automatically. It's a national level. It's public. Everybody's covered, and obviously because everybody gets an insurance card. But yet, of course, even though it is a public thing, the funds have to come from somewhere. So obviously, one way or another, during your income or whatever kind of way they tax over there would be through taxation, and that's how it gets funded. But of course, I mean, if you're from Europe but you don't want the public insurance, and of course, more than anything, you have the option of having a private insurance available to you, and that's totally fine. In Australia, it's a universal access, the same thing as Europe. Everybody has access to it. Everybody is allowed to have a public insurance. Of course, they tax you just like in Europe. Australia does use Medicare, and it was introduced there in 1984. It is a federal government, meaning the states are responsible for it. So any part of Australia, the states are responsible for it, meaning the ones who are in power, who have money, are the ones in charge of what kind of healthcare coverage is reported to their fellow citizens, I guess. But even though it is a universal access and the public does have healthcare coverage, the wells still have to fund it. But with funding it, it comes the power, meaning they have the option to take it away or not take it away. So it's a pro and con type of thing. You just have to really try to figure out if the Commonwealth government is really doing a good for their citizens rather than just pocketing in money for themselves. The way the Europe and Australia and US countries compares, they all have insurance, whether it's public, private, universal, or not universal. They have some sort of insurance they can provide to their people. Once again, like I said, people in all three countries have the option of getting a private insurance, yet they also have an option of having a public service insurance. It doesn't matter what type of country you are, everyone gets taxed for it for the majority of the time. Medicare, it's of course used in Australia, but also in the US. But in the US, you have certain boundaries to abide by in order to get Medicare. Contrast. You have Australia and Europe that have a universal access compared to the United States. US has had various health programs, insurance card, and of course the cost. Insurance card would be like Europe. They give their people an insurance card to access any kind of health coverage they may need. The cost, it just depends. Like I said, it varies from country to country because in Australia, it's a universal thing. So the cost for it, it's minimum to none. And the same for Europe. But yet, in the United States, it's not the same. Either if you get the public funds, then it's free. But if you get private insurance, you have to pay out of your own pocket. And if you don't have insurance, you still have to pay out of your own pocket because why? Because the United States doesn't have a universal access for a healthcare coverage. And another difference would be the health programs. Unlike United States, we have Medicaid, Medicare, and other health programs. Europe and Australia don't necessarily have those. But I guess it works out because even though they don't have those health programs, they provide insurance, unlike the US. If you don't pay for it, you don't get it. Here it shows two different types of graphs. So let's look at the first graph. The first graph, it shows a ranking of the countries and their universal coverage. As you can see, ranking number 12, it's the United States, and like I've been mentioning throughout the previous slides, that it isn't a universal coverage. It is, you either get a private or a public thing, but it's not all the country is free to have a health coverage. No. And if you really look at our statistics, the U.S. has a very poor statistic rating on how many people are actually insured in this country. And then of course you have Australia number 4, and it's a universal, which is great because a lot of their people benefit out of it. In the other graph, you have 2012. They did a study on public health expenditure per capita, meaning how much money is actually spent for the healthcare coverage. And as you can see, there's only 3 red lines, and in the very first one, the long one, it's the United States, and it shows how much money they have literally spent purchasing for the healthcare coverage. And it's ridiculous because, I mean, look at the other countries. You have Australia only spent 2,733. Example, Canada 3,000, Sweden 3,000, Germany 3,000, Austria 3,000. You know, so it's kind of ridiculous that United States spends so much money on trying to reduce the cost of insurance, but yet we're not universal. Kind of like a thinker there. Rankings. In the country of the United States, I would say that delivery care is ranked number 1, disease management is ranked number 2, and healthcare ranked number 3. Delivery care, because I feel that even though we don't have the health coverage that most of the people deserve to have, we still can't deny, the country still can't deny access to any kind of medical treatment or medical service, especially if it's an emergency. So, I mean, delivery care is priority number one, because no matter what, they have to treat you. I mean, if it's a living or death kind of thing, you have to go to the hospital and they have to treat you. They cannot turn you away. I would rank number two disease management, only because there is a lot of home health cares, home providers that uh, do go out of their way and help out those needs with chronic illnesses. But not only that, at least here where I live, majority of people are low income, and we're of Hispanic race, so our family tends to stay within each other and help out each other. And you'll have several people living in one household, so even if one person has a chronic illness and they have a family relative taking care of them, that doesn't necessarily mean they're medically certified to really know how their chronic illness is. But you know what? They take the job upon themselves and the responsibility to learn about that certain chronic illness, and they are providers for themselves. I would rank healthcare coverage at the very end for United States, only because it's not universal. A lot of people lack insurance here in our country, and even when you have insurance, sometimes it seems like the insurance companies don't even tend to help out its own clients. And just to get healthcare coverage, it's ridiculous for the prices that these companies are charging. For Europe, I would rank health coverage as number one, only because it's universal. It allows for everyone in their country to have access or have some sort of a coverage of insurance. Delivery care, because since they are all have access to it, since they all have access to it, then the insurance they have covers for whatever they need. So for them getting treated, it's guaranteed. And of course, you have disease management as the last one, because I mean, even though it's covered with the chronic illnesses, you don't really hear. I'm pretty sure there is a lot of chronic illnesses in Europe and in Australia, but you don't hear it as much as you would, I guess, in the United States. In Australia, it would be the same for the healthcare coverage, and the only difference would be I rank disease management number two, and delivery care as number three. It just doesn't show up on the PowerPoint, but I did rank it as number three. Um, Only because even though it's a healthcare coverage, it's universal and everything, they tend to uh, help out the chronic people who have chronic illnesses a little more than the European people would. And of course, they have great delivery services. But of course, again, I had to choose between either disease management being number two and number three for Australia. Best practices. I think the United States could really incorporate the universal access. Could really find a way to limit the cost reductions of these insurance companies if they don't feel like universal access would be a great benefit for us. And also, I think that Commonwealth government could be a thing. I mean, like in Australia, even though the Commonwealth government has the power to decide what kind of health coverage they give to their people, they still tend to give them a good source of healthcare coverage and still fund it, even though they have power for it. So I mean, they're still benefiting their people instead of themselves. So I think if, at least with our country, if Trump administration is gonna feel that they don't like Obamacare and they took Obamacare out and feel like their new health program could do great, then that's great. But as long as our people get some sort of beneficial healthcare coverage that is affordable, especially to the middle class and lower class, and if not, then I don't see why Commonwealth government couldn't be a practice that the United States could practice. I mean, after all, majority of the people who try to come up with the healthcare coverage are the rich ones, and they have the most money. So I don't see why they wouldn't be able to fund the healthcare coverage for our country in order to have universal access. I think that's just something that we should really think about, because we vote for these people, and yet they say they'll help us, but yet they pocket in more money than what they distribute out to the country. And I mean, we're a country, we're what, 50 states, so I don't see them providing healthcare coverage for those. At least, it's something minimal that everybody could benefit out of, so at least people could have something to fall back on if they needed a healthcare treatment. I know I said, here in the United States, they cannot deny you any access to it, but yet they won't deny it to you. But once the bill gets there, then what? Then you're back to the same thing. And then when you need to go to the doctors again, or you need to go to the emergency room, they sometimes give you this look like, well, we treated you once, but you haven't paid. Like, what's gonna happen? That kind of thing. So I think that's why most people also that don't have health coverage tend to not want to go back, and then they suffer with whatever kind of illness they've come up with, and it's kind of like a balancing thing that you really have to look at. But I think these three are very good practices that the United States could possibly incorporate into a new healthcare program or look into it. And of course, my slides.